Did you know that blood clots are the leading cause of preventable death worldwide? 1 in 4 people who die from blood clots could have been saved if they had known the signs and symptoms. In this video, we're revealing the 9 warning signs of blood clots that you can't afford to ignore. Even if you've never experienced blood clots before, it's important to be aware of these signs so you can get the medical attention you need quickly, because your life could literally depend on it. First warning sign: varicose veins. Varicose veins are more than just a cosmetic issue. They can be a sign of blood clots. These veins appear blue and twisted, usually in the legs. They occur when blood isn't flowing well, causing the veins to lose their strength and elasticity. This poor circulation can lead to blood pooling in the veins, increasing the risk of clot formation. While varicose veins themselves are generally not life-threatening, they can be a precursor to more serious conditions. For instance, they can lead to deep vein thrombosis, or DVT, a condition where a blood clot forms in a deep vein, usually in the leg. DVT can be extremely dangerous if the clot breaks loose and travels to the lungs, causing a pulmonary embolism. Similarly, blood clots from DVT can detach and go into lungs, which can then cause pulmonary embolisms, which are life-threatening blockages in the blood vessels leading to the lungs. Second warning sign: swollen feet or edema. Swollen feet, also known as edema, can be another warning sign of blood clots. This condition occurs when fluid accumulates in the tissues, causing the feet and ankles to swell. While there are many reasons for edema, such as heart failure or kidney disease, it can also indicate poor blood circulation and the potential for clot formation. If you notice that your feet and ankles are unusually swollen and the skin appears shiny or stretched, it's essential to consult a healthcare provider. Blood tests and imaging studies can help determine if a blood clot is the underlying cause. Treatment may include medications to improve blood flow and reduce swelling. Third warning sign: irregular heartbeat or atrial fibrillation. An irregular heartbeat, medically known as atrial fibrillation, is another warning sign of potential blood clots. While blood clots can cause chronic pain, fatigue, and other long-term health problems, in this condition the heart beats too quickly and in an irregular pattern. This irregularity can cause blood to pool in the heart, increasing the risk of clot formation. If a clot forms and travels to the brain, it could lead to a stroke. It's crucial to monitor any irregularities in your heartbeat. Symptoms may include palpitations, shortness of breath, and fatigue. If you experience these symptoms, consult a healthcare provider for an accurate diagnosis, which may involve tests like an electrocardiogram or ECG or echocardiogram. Fourth warning sign: loss of vision or retinal vein occlusion. Loss of vision in one eye can be a startling symptom of a blood clot. This condition is known as retinal vein occlusion. It occurs when a clot blocks the small veins in the eye, disrupting blood flow and leading to vision problems. Symptoms can include sudden blurriness or a dark spot in your vision. If you experience these symptoms, an ophthalmologist can perform tests to confirm the diagnosis and may recommend treatments like laser surgery or medications to dissolve the clot and restore vision. Fifth warning sign: arm pain or coronary thrombosis. Arm pain, particularly in the left arm, can be a significant warning sign of a blood clot leading to a heart attack. This condition is known as coronary thrombosis. The pain may start in the chest and radiate to the arm, accompanied by symptoms like nausea, dizziness, and sweating. Tests like an ECG or angiogram can confirm the presence of a clot. Treatment may involve medications to dissolve the clot or surgical interventions like angioplasty. Remember, blood clots can cause sudden death, even in young and healthy people. Sixth warning sign: basketball belly or hepatic vein thrombosis. A swollen abdomen, often referred to as basketball belly, can be a sign of hepatic vein thrombosis, a condition where blood clots form in the liver's veins. This can disrupt the liver's function and lead to fluid accumulation in the abdominal area, causing it to swell. Symptoms may include a tight, swollen belly, discomfort, and sometimes jaundice. This condition is serious and requires immediate medical attention. Diagnosis often involves imaging tests like ultrasound or CT scans and may require a liver biopsy for confirmation. Treatment options can range from anticoagulant medications to surgical interventions, depending on the severity and location of the clot. Seventh warning sign: one-sided numbness or ischemic stroke. One-sided numbness or weakness, particularly affecting the face, arm, or leg, can be a critical warning sign of an ischemic stroke caused by a blood clot. In this condition, a clot obstructs blood flow to the brain, leading to symptoms like sudden numbness, difficulty speaking, and confusion. Time is of the essence when it comes to strokes. Immediate medical intervention is crucial for minimizing brain damage and improving outcomes. Treatment often involves medications to dissolve the clot and restore blood flow to the brain. In some cases, surgical procedures like a thrombectomy may be necessary to remove the clot. Eighth warning sign: sharp chest pain or pulmonary embolism. Sharp chest pain can be an alarming symptom that should never be ignored, as it could indicate a pulmonary embolism. A pulmonary embolism occurs when a blood clot travels to the lungs, blocking one or more pulmonary arteries. This can lead to severe consequences, including death if not properly treated. The pain is often sudden and may be accompanied by other symptoms such as shortness of breath, rapid heartbeat, and coughing up blood. The severity of the pain can vary but is often described as sharp or stabbing. It may worsen with deep breaths, coughing, or even movement, making it different from other types of chest pain like that from heartburn or muscle strain. Immediate medical attention is crucial for diagnosis and treatment. Diagnostic tests may include a CT scan, ultrasound, or D-dimer blood test. Treatment often involves anticoagulant medications to dissolve the clot and restore blood flow to the lungs. In severe cases, surgical intervention may be necessary to remove the clot. It's important to note that the risk factors for pulmonary embolism often overlap with those for other types of blood clots. These can include prolonged immobility, such as long flights or bed rest, surgery, certain medications, and underlying medical conditions like heart disease or cancer. Therefore, if you have any of these risk factors and experience sharp chest pain, it's imperative to seek medical care immediately. Ninth warning sign: cramps when walking, or claudication. Experiencing cramps while walking might seem like a minor inconvenience, but it could be the most alarming sign of a blood clot. This symptom is known as claudication, and it occurs when blood flow to the muscles is restricted, usually due to a clot in the arteries. The cramps commonly occur in the calves, but can also affect the thighs and hips. The pain can be so severe that it forces you to stop walking, only to resume once you rest for a few minutes. Claudication is often a sign of peripheral artery disease, or PAD, a condition where the peripheral arteries become narrowed due to plaque buildup. This narrowing restricts blood flow, leading to the cramps experienced during physical activity. PAD itself is a significant risk factor for more severe vascular diseases, including heart attacks and strokes. Treatment may involve lifestyle changes such as exercise and diet modification, medications to improve blood flow, or even surgical procedures like angioplasty to widen the narrowed artery. We have covered 9 potential signs of blood clots. These can cause strokes, even in people with no other risk factors. If you experience any of these, consult a healthcare provider immediately for a proper diagnosis and treatment plan. Early intervention can not only alleviate the symptoms, but can also save your life.